Okay. And Bobby, if you could record that Commissioner Younger and I are here, and Commissioner Joe is absent, but we do have a quorum. Order of business, there's no changes to the order of business. We will have an executive session at the end of the meeting. Prior minutes, Commissioner, did you get a chance to review them?
Everything's good.
Okay, minutes stand as submitted. Consent agenda, is there a motion for that?
Yep, I'll make a motion to approve the consent agenda, items A through G.
I'll second that motion. We have a motion and a second. All in favor say aye.
Aye.
Motion passes 2-0. Are there any issues from people not on the order of business? It doesn't look like it. Monthly financial report. Commissioner, did you get a chance to review the report?
Everything's good.
Okay, the Child Care Awareness Campaign. Sarah.
Good morning, Commissioners. Sarah Wassinger, President, CEO of the Chamber here in Hayes, as well as facilitator for the Child Care Task Force of Ellis County. And I also have Dana Stanton here with me. She is from the Northwest Kansas Economic Development Center for Innovation. Okay, pretty lengthy title. She has graciously added into our efforts since she has started in her new position, but we just really wanted to take the opportunity to share with you some of the things that our task force has been doing over the past year, as well as give a ask for request for funds to help us with an awareness campaign that we would like to start at the beginning of this next year if possible. So we really started our efforts back in October of 2021, and our time spent together was really just getting the right people together in the room to make sure that we had the proper resources and people coming to those meetings to make sure that we had a good awareness of what our needs were as a committee. So some of the people that you'll see present at our meetings include not only the Chamber, but our Grow Hayes group. We have local school districts from Ellis and from Hayes who are currently coming. We also have early childhood development centers who are participating, and then we also have some local child care providers. And then, of course, institutions such as Fort Hays State University, Hayes Med have been involved in our efforts, and then, of course, our business community. We've had several of our larger employers in town who have joined us for those meetings too. And then definitely last but not least, we've had the Kansas Department of Health and Environment participating in those on a regular basis, in addition to Child Care Aware of Kansas, which has been a strong resource for us. So that's kind of who has been gathering on a monthly basis since we've started. The first big thing that we really did was conduct a child care needs assessment for Ellis County. And when I say that this is a countywide effort, it truly is. We surveyed nearly 800 people back in November and December of 2021. And you'll see a couple of slides in this presentation that share what information we collected. What I'd like to kind of make bigger note of is that 101 people surveyed identified that they would prefer a child care center over other forms of child care. 55 identified that they would prefer or currently provide child care in their own home. And then there's also a combination of care that 49 people identified, and then 74 shared that they preferred a school-based program option. The other thing that we wanted to kind of highlight was the top 3 barriers for child care in our community. Cost and affordability definitely was noted as number 1, with 76 saying that that was a barrier for them. And then dependability of care, 68 noted that as a concern. Quality of care, 63. And you'll note on the top that these are adults who are seeking care. So these are people in our community who, at the time of the survey, did not have access to child care. This next slide here shows really the areas that we need care currently. So these are the top 3 challenges for needs of type of care. So 105 people at that time were seeking infant care. And then we also had 84 who were looking for reliable care. And then we needed 82 spots for child care during the summertime. And then if you look on the left, the type of care for days needed, 53% said that Monday through Friday they needed care. 22% shared that they have a need for coverage on snow days, holidays, and summer break. 4% shared that the second shift in the evenings was a challenge for them, and then 6% early morning for those who work before the traditional workday. And then 13% shared that when their child is sick, they needed care, and then 2% for other. This is kind of a tie to our workforce, and this was what really got our Chamber of Commerce kind of overly passionate about this cause, because many of our businesses in Ellis County are still looking for workforce. You'll see the unemployment stats for September of 2022, and Ellis County was at 1.9% for that month. But 151 of those surveyed, 97.3% shared that they would reenter the workforce if they had access to quality and affordable childcare. So there is a direct correlation between need for care and our workforce in Ellis County, and that is not, and we are not unique in that situation. There are many other counties in Kansas that are facing that. So adults who currently had care, those who surveyed identified that their current child care arrangements included 110 people that had care in a non-relative member's home. 44 shared that they had care through a child care center. 35 identified that they have care through a school-based program. It's interesting to see, though, preferred child care arrangements for this group included 105 preferring child care in a center. So we have some families receiving care in a center that maybe would prefer not to. We also have 105 who shared that care in a non-relative's home was what they preferred. And then, of course, 78 preferred the school-based program arrangements. And I won't go through the demographic information, but that information is included for you to see who filled out those surveys. And then, the other two forward, please, thank you. So one more. There we go. Oh, I think we're going the wrong way.
That's where you're just at.
Okay, I might have doubled the slide then, so if you want to advance to the next one. Okay, so one of the things that we've been working on, you can go to the next one, Darren. I'm not quite sure what's going on with the slide. I think it got doubled somehow. There we go. So the survey responses, those seeking care, we had 270 who identified that they were seeking care and 361 who shared that they have care. Again, a big portion of those who need care currently are in that infant-based group. That is definitely a unique challenge. And part of the reason why we feel that that need is so big is because it costs more to provide care for children who are between the ages of 0 to 18 months based on how many children you can actually have at a center or at in-home care. And I won't go through the rest of them, but just wanted you to be able to kind of see what age groups are currently needing care in the county. And so this question was really based on trying to identify as a community and as a county what people feel our needs are for childcare. And you'll see that dependability of care was definitely very important to those, or somewhat important to pretty much a majority of all those who were surveyed. Quality of care, again, very important or somewhat important. And then the cost and affordability of care was the same, very important or somewhat important. We had 2 who only identified in each of those areas that that was not important at all. And then this kind of gives you a perception of our community needs. And so in general, families in our community have access to an adequate supply of childcare, and 219 surveyed answered that question, and 120% strongly disagreed. They feel that we don't have access to quality childcare in our county. And then access to quality, affordable childcare is an economic development issue. 99 of those surveyed out of the 217 strongly agreed with that statement. And then federal and state government should make child care services more affordable than they are present. 91 of those surveyed out of 220 identified that they strongly agree with that statement. And then county government has a role to play in access to quality, affordable child care. That one had 75 out of the 219 respondents somewhat agree, and 68 of those strongly agreed. And then churches have a role to play with access to quality, affordable child care. That one was kind of in the middle. We had 98 of the 220 identify that they didn't necessarily feel one way or another that that was a need. So we participated in a Communities in Action workshop back in March and had about 8 different people be a part of that process. Child Care Aware of Kansas really walked us through identifying some of our short-term goals and long-term goals to really figure out what we should be doing as a community. And the nice thing is they didn't feed us the information. It was us exploring what our different options should be based on who was in the room. The nice thing that we did within that was we identified the need quickly after that to start doing some different prospective childcare provider meetings in our county. And we then started looking at trying to create a county-wide benefit package for childcare providers. So we had meetings in Ellis and Hayes and Victoria throughout the spring of last year, and several of our current providers attended those, but we actually had 2 new providers who were identified that are any day away now from opening up their own child care businesses, so we know that those meetings had some success in helping open up some spots. And then after that, we put our efforts towards doing a child care provider appreciation and awareness campaign. So we actually went to the city of Hayes, and they were kind enough to do a child care proclamation for us. And we also had appreciation bags that we handed out to our child care providers after that event. So one of the things that we are the most proud of probably is the Hayes Med Project. We've been in communication with them throughout their process of applying for the different grants of that nature, and they identified that the needs survey that we conducted as a committee was very crucial to them being able to paint an appropriate picture for our needs, and that was a big portion of why they were able to get those funds. Also, we've been busy working on letters of support for many of our grant projects that will help open up spots either at center-based care places or working with in-home providers to see if those needs can be accomplished through our work too. And then also we've been busy doing some different child care level options for chamber membership. We believe that if we can elevate the profession, more people might be interested in providing care for our children in our community. And so things like health insurance for families, which we've kind of talked about that and shared that with you before, would be one of those options that they would have access to. And then we were actually going to be attending a child care summit in Lindsborg, Kansas next week. That got canceled based on lack of registrations for that. So that will be held in the spring, and we also plan on going to that as well. And then long-term goals, we currently have a need to fill 635 spots in Ellis County. So that's always going to be our priority, is opening up more spots, because that's why we started in the first place. Providing continued education for our current providers and making sure that we can do that for limited to no cost. Developing a pay-to-play program that would allow businesses to possibly put skin in the game from a financial standpoint to have a certain amount of spots opened up for their staff to utilize for childcare. Giving access to benefits like we already talked about for health insurance to providers, and then creating livable wages. Obviously, the sustainability of childcare is an issue. Many of our childcare providers don't make what would be considered a livable wage, and that figure would be around the $18 per hour mark. Adding CDA certification at our local high schools. So Hayes High is actually currently working on this with Donna Hudson Hamilton from Early Childhood Connections, to where students could actually graduate from Hayes High and already have most of their certification requirements met to open up a child care business. And then establishing a foundation to help kind of subsidize some of our efforts. We know that if we're going to fix childcare, it's a big root problem, and we need to build up a foundation in order to continue to sustain the efforts to make sure that this just isn't a Band-Aid situation, that we're actually addressing the root of the problems. And then also considering stipends for our long-term providers. We want to make sure that they know that they're very much appreciated and a part of the solution. And then working with our local elected officials. Kansas is one of the most highly regulated states when it comes to childcare in the United States. And it's not that we want to eliminate things that create safe childcare environments. Are there things that we could work on adjusting that would still provide high quality of care, that would not be inhibitive to providers, and would still make it a little bit easier perhaps to get in the childcare business? So those are the things that we're looking at from a long-term perspective. And the next slide will actually include information. If you're not aware, Child Care Aware of Kansas does something called a point-in-time survey, to where you can click on this on a daily basis. They are constantly calling child care providers to see what spaces they have open. And so this is pretty close to as real-time data as what we can get for how many spots are needed to fill in the county. One thing that's interesting with Ellis County is we actually have more in-home providers than our cohorts do in similar sized communities across the state. And so we actually have currently 8 centers and 74 in-home providers that are working in Ellis County. And I was actually talking with Dana. The figure is something close to $4 million for funds that actually get invested into childcare in Ellis County on an annual basis.
$6 million is spent on childcare in Ellis County each year on average.
Thank you. So I won't go through all of this data because I know you have other things on your agenda. So next slide, we'll identify our short-term goals, and this is kind of why we're here visiting with you today. We were awarded a $30,000 grant from the Schmidt Foundation to work on something called a child care awareness campaign. Obviously, there's a lot of grant funding out there that exists that would give us capacity to put dollars towards physical locations. The most challenging piece of this, however, is actually going to get people who can come up and be child care providers, whether that be in a center-based facility or providing care within the home. We have sought after other grant funds and have at this point in time not been successful as what we would have liked to be. And we know that the longer that we wait, the more exacerbated the problem could likely become. So we worked with Eagle and Hayes Post to try to come up with a list of things that we could do to do an awareness campaign that would last a year long. And it would include radio advertising, things like push downs on Hayes Post, some of the advertising that they have that goes throughout the month. We would be doing some geofencing. That's kind of a fancy term for targeting different people when they're online. And we would be able to, if they're searching for things like childcare or things that involve young children, we would be able to kind of follow them wherever they go and have ads that would pop up on their devices to kind of get them more engaged in our process. So, and then we would also have over-the-top advertising. We know that a lot of families get their programming through online streaming services nowadays, so that would also be something that we would tackle too. And then some of our other short-term goals include creating a child care provider substitute pool. Dana is actually working on that currently and is going to kind of be taking that over, but we'll still have people on our task force who will be a part of that progress. And then conducting focus group meetings. We actually just conducted 2 last week, and we'll have 3 more on November 17th. We would welcome you if you feel like you would like to come to any of those to attend them. Those dates and times are listed on our chamber calendar of events. I think we have one with our education group at 9 a.m. that day at the Welcome Center, one with our faith-based group at 1 o'clock that day at the Welcome Center, and then one at 6:30 p.m. with our parents in the community. So this is just a little bit about where you can find more information about our efforts. And I know I've taken up quite a bit of time. We do have a child care provider recruitment video. If you feel like you would like to watch that later, you're definitely welcome to do that. But this would kind of be an example of the type of information that we would be utilizing in our awareness campaign to get people involved in that child care process. And then our next meeting date, of course, would be at the Welcome Center on November 9th. I don't think that's right. I think that would be November 17th at 4 p.m. So, but I would stand for any questions if you had any.
Okay, Sarah. Well, you definitely got a lot of work cut out for you. This whole child care issue, that is definitely a multifaceted issue. There's no simple solution to it. I guess as I've talked to some people, they say our system is really completely broke in Kansas. I don't know how they're ever going to fix it. You cite a lot of rules, regulations. I think it's going to be up to the legislature to try to look at some of that, see what they can do with it. I know a lot of people just don't want government in their homes. A lot of child care is unaffordable to some people. So there's just many issues with this. Now, have you obtained that $30,000 grant from the Schmidt Foundation?
They have shared that we have to get $30,000 worth of up to matching funds in order to be able to open up those funds to use for the awareness campaign. So until we're able to, and by the way, I could go back with them and refigure and pull some of the things out of the campaign to make it a little bit smaller if needed. We just really are in that process of trying to figure out if we can accomplish kind of how things are set up now. If we're not able to maximize or match those funds fully, I would go back to them and figure out a different strategy for us to employ. depending on what money we would have to work with.
Now, have you garnered any matching funds so far?
So you are my first presentation. I'll be working with our Kiwanis Club in Imagine Ellis County actually later today. And then our Hayes Young professionals through the chamber are looking at considering a $500 pledge as well. And then based on this conversation, I also have a meeting with the City Commission on Thursday evening to do the same presentation, asking them to consider a contribution. And then at that point in time, I was going to see where our budget stood and figure out what other perhaps nonprofit organizations we might be able to visit with. There are a lot of good groups in town that do a lot of wonderful work to advance children in our community, and that was going to kind of be our next steps depending on where the funding landed.
Is the business world interested in contributing to this?
I do have a couple of businesses that have shared that depending on where things slide, they would look at their budgets for different funding solutions and see what they could do to help contribute as well.
Okay. It does say in the information I have that you have applied for over $1 million in funding for child care projects. Have you received any funding?
The work that we've done has gone towards applying that. We maybe weren't the direct application for that. Hayes Med specifically had earned a $750,000 grant for their project that they'll have going on by the beginning of 2024.
Okay.
And then we've also ascertained approximately about $45,000 pending approval from Child Care Aware of Kansas for another grant that we just applied for. We haven't heard back from that. We also applied for a Rural Champions grant. That was a pretty stringent process, and we unfortunately did not earn that grant either. That was going to help give us another person to work part-time for an entire year for the child care efforts here.
Okay. Well, I do have some concerns, and one of my concerns is if we put up some money for this issue, it's not going to be just a one-time deal. I believe the task force will be knocking on the county door every year. And I do have an issue with that because we have our own county needs that we do have to allocate resources to for county operations. And I think, you know, as the taxpayers open their tax statements in just a couple of weeks, I feel like Commissioner Neal and I are going to have to be buckled in for that. It's going to hit pretty hard. So I just do have some concerns about that. I'm not saying I'm not in favor of it. I just have some concerns. Commissioner Neal, what are your thoughts?
Well, as you and I talked earlier, and again, thanks for taking on this big task. The Vine Street project, no help. If this goes through, which I'm sure you're going to try 100%, I'm definitely for it to get some more workforce out on, instead of, you know, either dad staying home or mom staying home. Is that the answer? But no, that's a start. And yes, my concern is too that you'll, you know, return every year back. But if we can see progress, I'm good with that then, to have child care and create jobs and keep our community going. But again, thanks for taking on this big project task and all your help to your staff.
So, Commissioner, we can do one of three things here. We can either approve some funds today, we can defer this till after people see their taxes, and we can get more feedback from that, or we can just deny funds. I'm not really in favor of just denying funds. So I guess, what are your thoughts?
Like I said, I'm definitely for the child support, because it is not just in Kansas, it's everywhere. And so my feeling is to support it and as you're returning every year, we'd like a good report to see and where that money's going, how, who, what, and when, so.
We would be happy to provide a report as frequently as you would prefer and share updates on progress on different projects that we would be working on, or if we had new contacts for new providers coming in, we would invite them to come introduce themselves and let you know where our current efforts are.
Commissioner, what do you think funding level you would like to see?
I would like to award them the 15.
15,000?
Yep. And I also like the idea that you're getting the high school kids involved in it, make them have some responsibility, not that they don't, but this will really put it on to them to, when they decide to have a family, this is what it's all about, just looking into the future.
I think, Darren, you said if we did decide to fund this, that we could take funding out of contingency funds for it. Is that correct?
Correct. We have enough remaining in contingency funds to be able to cover this. We do have, excuse me, we do have one project that's coming up probably in the month of November that'll be brought forth to the commission, but even if that project is approved, there's still funding for this available.
Sarah, I know this problem's been in the community for quite some time. Has it gotten worse since the pandemic?
Well, interestingly enough, when we started our efforts, the point-in-time data showed that we had 700 spots that were needed to be filled. So we actually have seen some progress. That Hayes Med project would actually open up 77 spots. And then we have had some meetings with different leadership at the county level and at the city level for a CDBG child care grant. We're still in the process of working with some of our center-based care facilities or people that we know might be working on projects to figure out what that would look like or what that could look like. And then we've been directed to put information together for those projects and then come share more information individually with those entities. And then at that point in time, we would share with you if you would invite us to attend a meeting to present on that. But I would say the pandemic probably didn't do us any favors when people had to go home to work because, you know, the stay-at-home order was put in place. Families got pretty used to staying at home, and as our workforce is reopening back into businesses and things of that nature, that option to provide care in home just doesn't exist. Unfortunately enough, we've also heard some stories, and I can validate them because many of them are acquaintances of mine. We have families that are holding off having additional children right now because they don't have spots for childcare, and as a county, on a task force, we find that very concerning, and we appreciate the quality of life that exists here in Ellis County, and we know that helping address the root causes of our child care will kind of put us in a better position moving forward when we compare ourselves to other counties across the state.
Okay. Commissioner, do you have any other questions?
I do a lot of the young generation, when their child provider leaves on vacation, they're stuck, so either mom or dad has to use their vacation to stay home. Will this also help out is there slots that they can bring their children so they can still be on the workforce?
One of the things I didn't talk about because we're in the very infant stages, no pun intended, of the project, would be kind of a transitional care facility. It would be possibly modeled after some different projects that other states have tried. But if a particular child care provider facility, maybe they go on vacation and would be closed, we're still looking at could we have a different space opened up to where those families could still bring their children there for a week or 2 weeks, kind of a temporary care solution. But we're, like I said, we're still in the very early part of that. So we are truly trying to think of this from a very holistic approach and identifying the gaps that we know we have. Our providers have been fantastic in giving us feedback as to what their challenges are, and we're very much working on trying to ensure that the things that we're considering as a task force help give them the resources that they need to be successful and also support the families that they serve.
Okay, thank you.
Okay. Commissioner, I will make a motion to award $15,000 in matching funds to the Child Care Task Force of Ellis County.
I'll second that.
We have a motion and a second. All in favor say aye.
Aye.
Motion passes 2-0.
Thank you, Commissioners.
Thank you, Sarah.
Thank you.
Okay, now we have the authority to award for Northwest Business Corridor Project. Brandon?
Good morning, Commissioners. Brendan McKay, Ellis County Public Works Director. So before you this morning is the new revised authority to award agreement for the Northwest Business Corridor. KDOT is administering the project. We signed one of these beginning of the year, made our payment to them, which would be the total amount we would need to contribute to the project. With the new funds that we've received from Build 19, from leftover funding that we applied for, this changes the amount of share that the county would have to contribute. So we need to update our authority to award to probably match where the funding's coming from and what sources. So this would allow a potential refund to come back to the county for the project. And we've already signed the grant agreement, the new Build 19 revised agreement. So this is just the final piece, I hope.
Well, anytime we can get money back, that's good.
Yes, sir.
That's going to be used for other things. Commissioner, do you have any questions?
Nope, I'm good with that.
Yeah, do you want to make a motion on
I
this?
will do that. I move that the county commission accept and sign the revised authority to award packet for the Build 19 grant for the Northwest Business Corridor.
I will second that motion. So we have a motion and a second. All in favor, say aye.
Aye.
Motion passes 2-0.
Thank you very much.
Thank you, Brandon.
Hey, Brandon, can you give the community an update on Ellis Avenue, please? How we're moving on that?
So we're almost done.
Okay,
I'm sure there's already been a lot of traffic through there that go around our barricades. So some have already seen it. It's not done yet as they saw it. So if you heard complaints up to now, take it with a grain of salt. We weren't complete. So we've got a few more pieces of equipment to move out of the way. The patches have all been milled up. Rock's been added and they've been remilled and mixed up. They've been compacted down. And what we're going to do now is we're going to water them and hard blade them to remove any bump of coming on or off of them to the existing pavement that's left in between the cycles.
okay, all right, thank you.
Yeah.
Sounds good, Brandon.
I wanted to thank Rush County, my counterparts down in Rush County. Without them, we wouldn't have been able to complete this project. Because as you're aware, our pad foot single drum vibratory roller was destroyed in the fire that happened just prior to the project start. Thankfully, our counterparts in Rush County have an older pad foot that was nearby that they let us borrow for the 2 weeks to do the project.
That's good.
Otherwise,
Well,
wouldn't
thanks,
have been able to do it.
thanks Rush County.
Yep, we work together with our neighboring counties well to help each other out when we can.
That's great.
So, thank you.
Okay, thank you, Brandon. Okay, the district court brand. Judge?
Good morning.
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 Good news. We are here to report that we were awarded the federal grant for our drug court in the amount of $749,266. That is a 4-year grant. It's a renewal of an earlier grant we received. It was, I have to tell you that our court administrator, Mike Smith, and our chief court services officer, and Teresa, who is our drug court coordinator, had to put in a lot of hours. And anybody that's worked on a federal grant knows what I'm talking about. The amount of information you have to assemble and the volume that is involved is tremendous. We sat on pins and needles waiting, and we were told we would hear right the end of September, and the end of September came and went. We hadn't heard, and it was like without this grant we couldn't operate, and it came through the first week of October. So if you heard some shouts of joy from the courthouse, that's what that was associated with. Historically, as you know, drug court started with a one-time $30,000 grant from the Ellis County Commission over 4 years ago. That was the seed money that got us started and got our feet on the ground, and we actually have some of those funds still remaining that we are using that for items that we cannot use the federal grant money for. So I think if you look at the accounting for those initial funds, we've been very good stewards of the taxpayer dollar. So I just wanted to come and let you know that we received the award. We appreciate the Commission's initial grant and all the support you've given us with the drug court. Teresa has some statistics on our number of graduates. The drug court grant that we received is going to allow us to do some additional substance abuse services. We are starting a peer mentor program. A lot of our participants in drug court unfortunately need, due to addiction problems, a lot more support than the treatment provider can provide or the mental health provider. And so to fill that gap, we have started a peer support service. And in fact, one of the peer mentors who has received the training and obtained the certification is one of our drug court graduates. And she has gone to work for High Plains Mental Health Center. She brings a unique perspective to our staffings. We are also working with Smoky Hill Foundation, and we'll be having some available funds. They have a peer mentor on staff, and will allow her to as well provide services to our drug court participants. The federal grant pays for our defense attorney, which is not, as we all know, attorneys are not inexpensive, so that allows him to provide those services. And he also is one of our contract attorneys for what the commission is required by state law to fund, which is our contract lawyers. So it frees him up to handle the full caseload there. We are providing mental health counseling. Many of our participants have co-occurring disorders, so they have not only substance abuse issues, but also an underlying mental health problem. And so High Plains has stepped in. One of their members is part of our drug court team, provides valuable information to us, and as well as allowing our drug court staff, some members on an annual basis, to go to the national conference, which is it's a sight to behold. Teresa and I went to the very first one in Houston. There were over 6,500 attendees from specialty courts all across the country. We had some of the most dynamic presenters, information. We started at 7 in the morning, and our last session ended about 6 o'clock at night, and we had a little break for lunch, and they were not to be missed. You know, a lot of conferences you go to, you have to hit the snooze button a couple of times to wake up. This conference just provides tremendous information, resources, innovative ideas, many of which we have incorporated. So it's not a vacation by any stretch. It's a valuable thing, and we've learned a lot. Teresa has been named to the Legislative Specialty Court Committee that the legislature established last year, so she's providing a leadership role there. I was appointed by the Chief Justice to chair the Supreme Court Specialty Court Committee, so Ellis County, the only specialty court, only drug court in the entire western half of the state, is also now participating at the state level in leadership positions, and lots of stuff in the works. So we are, Salina hosted a regional, which turned out to be a statewide conference here recently. We attended, and we're building from that. So a lot of good things going on, and you know, you can take great pride in knowing that your commission, through taking a leadership role and being innovative and giving us that money, has really put a beacon out here. We have a lot of recognition around the state, and we are always mindful to let everybody know that it was the Ellis County Commission that got us started. And so anyway, again, our thanks, and then also, like I said, good news. We have never come back to ask for any additional funding, and we don't intend to. That was the deal we made, but without it, we wouldn't have got started. So thanks again. Teresa?
Yeah. Thank you very much. I just wanted to brag a little bit on our program. We began in August of 2018. Obviously, we came here for some startup money. We've had over 100 people go through our drug court now in some capacity. We've graduated 43 to date. We currently have about 20 active participants in the program. We've had as many as 20 up to 33, I think was our highest. We've done some good work. We are on the the forefront of drug courts in Kansas. I know that the concept is going to be expanding not only nationwide, but Kansas has recognized that these courts work. They help with recidivism. So my name comes up, our name comes up often when someone is starting a new drug court. We've had multiple drug court teams come to observe our work. So I appreciate, again, that startup money. Our entire drug court team works hard to have a good program to benefit Ellis County. So thank you.
Any questions?
Well, I guess, first of all, congratulations would be in order for the hard work you've put into this program, both of you, and the recognition you've been able to bring to the drug court and Ellis County at the state level now. So, again, congratulations.
Thank you.
Well, we have, I see the sheriff is here. We have a member of the sheriff's department on the team. We have a member of the police department on the team. So it's a universal and countywide, citywide program. It has been, when we were looking at getting started, I interviewed a number of drug court judges around the state, and everyone told me the same thing. They said, Glenn, if you do it, it'll be the favorite thing you do as a judge. And now when I've had judges call me and say, we're thinking about starting a drug court, I say, let me tell you something. If you do it, it'll be the favorite thing you do as a judge. So it's, I tell people that I just feel blessed that I had the opportunity to be involved and to see these people succeed. Because I sure see the failures. I had a whole bunch of criminal docket yesterday, and so I see the failures, and it's so nice to have every other week to see successes come in front of the court. So, pretty special.
Well, your efforts and enthusiasm are to be commended.
Thank you.
Yeah, just a couple of comments. Thank you for representing Ellis County, so all the Californians, Colorado's drive through. Kansas ain't just flat. We're on the map. Thank you, guys. I've been to several of your drug courts. Some of the individuals are starting to know me by name that are sitting with me. It's great that you guys are doing, I don't know what you're doing behind the scenes, but you're doing a great job and saving lives. So thank you for your service and what you guys do. And like my father-in-law said, good things come to those who wait, and it happened. So thank you.
Thank you.
Thank you.
Okay, thank you. County Administrator report. Darren.
I have nothing today.
Okay. County Commission reports. Neil.
I attended the Ellis City meeting last night. Some pretty interesting things there. Next thing, make sure everybody gets out and votes, and also like to thank all the vets. So if you see one or two or three, Darren, thank you, and that's all I have.
Okay. And I have no report. Executive sessions, I'll make a motion, we go into executive session for 10 minutes to discuss attorney-client privilege. And those attended will be the board, Counselor Jeter and Administrator Darren.
I'll second that.
We have a motion and a second. All in favor say aye.
Aye.
Aye. Motion passes 2-0.
All my marbles here. You want to do it for me?
Okay, there's no action taken. And our meeting will adjourn at 9:29. That was quick and painless.